Hey everybody, I wanted to film a quick video about some of the staff that you'll deal with if you become a foster parent or you potentially could deal with. Um, so I'll try and start with the ones that almost everybody is going to have as far as the state of Arizona is concerned. And then I'll switch into if you have some behaviors and kind of what we've experienced. I just want to preface this with all of my animals are free roaming right now. So if you hear them, I'm sorry. Right now I'm filming with just my laptop camera, so it's not anything technical or beautiful here. But I just feel like getting some of this stuff out. So here we go. So the first person that everybody's going to have to deal with is a state case manager. So it's DCS for us here in Arizona. And they are the person that is technically the legal guardian of the child. So they're going to make sure that the child's needs are being met, that the child is getting all the services that they need, whether it's therapy for like speech, occupational therapy, any of the like behavioral cognitive therapy. I'm sorry, usually it's cognitive behavioral therapy is how they say it, but whatever. All of that stuff. They're going to coordinate all of that. They are also the person who makes sure that the money for the child gets processed appropriately. So in the state of Arizona, you are paid as a foster parent. It is about $600 a month per child. And I can break that down if you want. There's like a clothing allowance and some other stuff that goes in there. The child is also entitled to an allowance monthly. It's right under $10. So we give the girls their $10 every month because our girls are younger. So we're trying to teach them how to manage money. And I'll get into that in another video probably. But yeah, they're the person who makes sure that all of those things are happening, that the kid is getting their allowance, that you are getting paid. They have a clothing allowance that comes out. You make sure that you get that. In the state of Arizona, the state will pay for daycare. They do not cover the full cost of daycare, but they will pay for daycare. And then if your child is school age, so like elementary school, K through 6th, at least in our school district, they have a before and after school program. So if you work and you want to foster and you're like, well, I just don't know how I'm going to do it because my kid doesn't have to be at school till 8 and they get out of school at 3 and on Mondays they get out of school at 1 and how do we do this? The state actually pays for the district run before and after school care, and you contact your case manager, who then gets in touch with the Department of Economic Security, I guess it is. I can't remember what it's called. And they request those funds. What else? They write all of their reports for court. When you go to court, they're the person that tells the district attorney, like, this is how the kid's doing. This is all the progress on the parent. They are also responsible to make sure that the parent has all the services that they need, not the foster parent, the biological or whoever had custody of the child before they came into care. That parent has all of the services, whether it's like marriage counseling or therapy for that parent, or if they are doing supervised visits, if they have a case aide, or if they have a parent aide. So case aide, they go to a visitation center and the case aide just watches. A parent aide, they usually will go out into the community or at the parent's home for the visit, and the parent aide will have like set goals that the parent is supposed to accomplish throughout the time. So that's another set of people that you'll deal with. You'll either have a case aide or a parent aide to supervise the visits. And then you'll have to deal with transport. So for us, because of the situation that we're in, I transport the girls to visits. Most of the time, though, the state will have the company that's contracted to supervise the visits. Those people will transport. And I've heard with babies, it's awful when they just have a case aide, because it's a different person to come pick the baby up every time, and they have weird car seats. They don't know how to set the car seat up. Like, it's not comfortable out here for people with babies, just because of the transport situation is complicated. But so those are the people that really deal with the parents. Another person that you as a foster parent will have to deal with is the licensing worker. So in the state of Arizona, you are when you decide to become a foster parent, you go and you meet with licensing agencies. I would suggest you meet with a couple. I wouldn't just meet with one. We've had 2 separate ones. That's part of why I'm telling you to meet with a couple of them. The agency that we're through is really great. They have like behavioral services. So like if you get a child and they are really having trouble, you don't have to wait on the state, your caseworker, to request therapy or like what they call crisis stabilization, which is somebody that comes out and helps get the child stabilized. You don't have to wait for DCS to do that because the licensing agency has those services somewhat embedded. So they can help you ride out the storm until you get the permanent services that you need. And the licensing agency's job is to make sure that you as the foster parent are doing what you're supposed to be doing. So making sure that your guns are locked up, that your medicine is locked up, that what else? Crazy. That you have a fire extinguisher and a first aid kit, that all your fire smoke detectors work, your dogs have rabies shots. What else do you have to do? Oh, all your car registration and insurance is up to date. All your, like ours has us write a monthly report. I know in one of the videos I said that our agency has us fill out a lot of paperwork. So ours does, like we fill out a lot more paperwork than I had to with the old agency. But at the same time, like it's good because anything that you do wrong is under like severe scrutiny. So the more paperwork you have to cover yourself, the better off you're going to be. So that's what the licensing agency does. You're also going to have a guardian ad litem for your child. That is the child's lawyer. Basically, they go into court and they speak on behalf of the child, what the child needs, how the child's doing. Sorry, my beagle is in here. She's wanting to howl. They will explain to the judge, like, yes, the child's meeting all of their milestones and they're doing great in school, or no, this is the services that they need. They'll also speak to how they feel that visitation is impacting the child, positive or negative. That's kind of what they deal with. If your child is Native, so if they are an American Indian, and depending on where you're at, the tribe that they're with or the community, depending on which, they like to be called different things, but they will have a social worker as well, depending on how they want to handle it. They can take complete jurisdiction of the case, and then like you don't even go to court for them at all. You're not even allowed in there, because it's all done by the tribe. So that's another one that you'll have to deal with. I'm sorry, I have some notes over to the side. So I think that's all for like just the standard what you're gonna deal with. If your child has severe behaviors, you could have a combination of these next few things, or you could have only one, or you could have none of them. It just depends. The experience that we've had, so you can have a clinical therapist, which is a person just like an adult would go to. You go in and with the child, they more like play games and try and like talk about things without directly going into the situation. But that all takes time. You have to build rapport. You have to make sure that the child feels safe. You have to make sure that the child knows that whatever they say in there is confidential. So that's a really long process. Standard cognitive behavioral therapy is a long process, especially with a child. You also may have a behavior coach. Behavior coaches come out to your home and they strictly work on behavior. Like, what is the child doing that you need them not to do? Or what is the child doing that you need them to do? Like they are having anxiety every time you tell them to brush their teeth, or they are eating out of the trash can, or they cannot keep themselves calm when they think about doing their reading homework. And so the behavior coach would come out and assist them in your home with that. Now you may ask, like, what about school? My kid's fine at home, but they have issues at school. Your school has staff in place to deal with that. So they have what's called resource teachers, and their job is to help your child cope at school. There are people there paid to do that. So if you're worried about, I'm a foster parent, what if I keep getting suspended, if the kid keeps getting suspended and I have to pick them up all the time, there are IEPs, individual education plans, and then in the state of Arizona, there's this thing called a 504 plan, which is basically just a behavior plan. So it says that the school can't just keep suspending the kid because the kid's acting up. Like, they have to deal with it. Bottom line, there are things that, are set in place so that you can set the child up for success. So that's another whole set behavior coach versus resource teacher, that kind of thing. There's also a program called like Meet Me Where I Am. I'm not familiar with that, but it's kind of the same thing. They come into your home, they work with the kid on the behaviors, they see how they're doing. And then a youth and family specialist is kind of the same thing. All these people, they're different levels of intensity, but they all kind of do the same thing. They're there to help the child, and they're there to help you deal with, like, give you some strategies on how to deal with whatever the child is doing. Crisis stabilization in the state of Arizona, usually that'll get set up. They're usually only open for like 6 weeks. When I say open, that's how long they're supposed to be with you, is like 6 weeks to 90 days. And they are basically designed to come in and just get the child comfortable and functioning like they should be. Like, just get them ready to where they're not having like huge behaviors or huge fits or any of this kind of stuff. Because like I said in a previous video, sometimes these kids will have temper tantrums and they look like it's reminiscent of a 2-year-old, except this child is like 5. And so they're bigger and they can do more things, or they have different behaviors. So that's kind of what crisis stabilization does. You'll also have, if the child is put on any medication, and I can go into how I feel about medication later, but if a child is medicated, you'll have like monthly medication monitoring or quarterly medication monitoring. So you go in and they basically you tell the doctor, this is how the kid's doing, and they say, okay, let's try this. So you try this medication, and if it works, fabulous. If it doesn't work, they can alter the cocktail a little bit. And I say cocktail, but like usually it's a combination of a couple things. If you're giving them child medicine and they're turning into like a zombie, it's a problem. So you want med monitoring. And yeah, those are, high needs case manager. High needs case manager basically coordinates all the therapy. And there are tons of types of therapy. There's equine therapy, there's regular like play therapy, there's group therapy, there's all kinds of therapies. And the high needs case manager, if you have one, can coordinate all of that stuff for you. So that's all the staff that you can really deal with. I'm sure that's not all of it. That's not an encompassing list. That's just what I'm really familiar with. If you guys have any questions about staff or getting help with your child, let me know. I can see, what I can find out for you. But that's just kind of the gist of what we have dealt with or been exposed to so far. So yeah, thanks for watching, guys. Bye.